All right. Hi, and a very good morning, everyone. Firstly, I would like to welcome everyone here for this lovely morning here at the IDC. I would like to welcome our CEO, Mr. Vijay. And firstly, I would like to thank you, Dr. Ajay, for his very warm welcome and for this opportunity to speak here as a fourth year dental student and as your scope president for the 2024 and 2025 tenure. So my name is Anisha Zana Sofia, and today I'll be sharing a bit of insights on what's the transition from the school to college life, what's the dentistry in an essence, and how to thrive academically, personally, and also socially. So I hope you'll get excited and get a bit of an inspiration from this. And feel free to interrupt me at any time so we can make this session more engaging and interactive as much as possible. So let me begin by sharing a bit of my background and how I arrived here as a fourth year dental student. So I was born and raised in Malacca, and I've attended MRSM Alor Gajah, which is in Malacca, and studied in the science stream for my Form 4 and Form 5. So, like most teenagers, when you ask them, what do you want to be when you want to grow up? What do you want to do as a living? And I believe most of them would say, I am not sure. I don't know yet. Or I get it figured out later. I was that very person. But a tips from me is high school is the very crucial time for you to figure out your career pathway because you don't actually need to figure out what exactly you wanted to do, but at least figure out what kind of field that you were interested in. So I know I mathematics is not my forte and engineering has been out of the list already. And I like sciences. I enjoy really studying chemistry, biology, and also physics. So I figured out that I might do something related to healthcare or sciences. And yeah, and how do I come to choose dentistry specifically? So when it was high school, I had a session which is called a mock interview, where we will need to prepare a portfolio and what of the career that you want to be, what career that you were interested in. And I was considering medic or dentistry at that time. But as I did my research, I've come to find out that dentistry might suits me best. And there's a few reasons for it. For the first time, is dentistry is a very combination of the health science, which I already love, art, and also health itself. So I figured that dentistry offers so much more than just opens up a clinic, do a filling, and do a restoration. There's many specialties under dentistry itself. And the second reason is the work-life balance itself. Unlike any other healthcare professions, dentistry offers a more flexible with the regular routine, which is what I want to do later. And third one is helping a person, or in our case, patient itself. So as a dentist, you really can make changes in someone's life by simply restoring a smile or just relieving a pain. So in that sense, in my case, doing that as a living really gives you a sense of satisfaction. I really want to lead a purposeful life. That's why I proceed dentistry. So then and there, I decided I want to do dentistry. So I worked hard for my SPM. I received 10 A's, and it really opens up doors of opportunity for you. You can apply for more scholarships. Okay, after SPM, now I will start applying for scholarships, right? So my advice for you is to apply every scholarship that aligns with your interests. You never know what lies ahead of you, but at least you can just get a bit of experience underwent that interview, just for your experience. That's why I suggest you. So during my time, there's the two main options for scholarship that offers in healthcare and also medical, basically. It was JPA and also MARA. But JPA at that time mostly offers on medical courses. It doesn't offer any in a dentistry, any in a dentistry setting. While MARA, that offers one dentistry course, which exclusively done here in PIDC. So I went through all the interview sessions and I managed to secure the MARA scholarship, which is called the IESP program. It's a IGMA Excellence Scholarship Program, which it starts by you doing a foundation in science. And it was done specifically in College Marakulim before you transitioning into your chosen university. Let's say there's a many university at that time, but you done your foundation first and then you proceed with your university. So one good thing about this program is that you only need to achieve your minimal CGPA requirement, then you basically halfway into your degree already. You're like one step into your university. So you just need to get your CGPA done. So that's how I did my foundation in science. If you're not, if you haven't done foundation in science, the other way is to enter a matriculation or just do an A level. Yes, that's it. So after that, that's the start of my dental student journey, which I've done Doctor of Dental Surgery course in PIDC. So the first 2 years will be in Masa, which in Selangor, and the 3 years of the clinical years will be done here in PIDC. Yes. Now the transition between the school to the college life. So how different is school to college life? It's very different, to be honest. So from school, it was very teachers oriented. While in college, you yourself will push yourself and manage your own study schedule, because you will have your own self-discipline on how you manage your study. Of course, your lecturer will be there for you, especially here in PIDC, our lecturers are very helpful. But you need to seek for them to actually get your work done. And the second one is study method. While healthcare, you might need to learn only from one textbook. Here, you need to read from multiple textbooks, from references, from journal to actually solidify your knowledge on things. So, and learning in college is mostly based on applications. Application-wise, you apply the things that you learn in your clinic. And of course, you will not be on your parent supervision in college. You'll be independent, you're a working adult, so you need to manage your life well. That's it. And how was academic life at PIDC? So the year 1 and the year 2 are the pre-clinical years, which was done in Masa. So at my time, that was a COVID time for my year 1. So there weren't much going on. Most of the class were conducted online. We only attend a few lectures and labs physically. So there weren't much going on in year 1. But the year 1 subjects, which are the anatomy, physiology, biochemistry, and also oral biology. And the year 2, microbiology, pathology, pharmacology, and also dental material and equipment. So you might be wondering, why is this subjects important for you? Because I want to do dentistry, just get me into clinic and get it done. But it is important for you to build your fundamental knowledge. Let's say you want to, for example, you want to do extraction, but to take out a tooth from someone's mouth, you need to know a basic anatomy of someone's face exactly. So with a proper and thorough understanding of this subject, it can help you to perform the procedure better. And subjects like microbiology and also pathology, it helps you understand how a disease actually develops and how it progresses. By understanding this, then you later know how to treat it. Without knowing a thing, how can you treat it, right? So this subject is important. And the last one is for you to have a very smooth transition from a preclinical years to clinical years. Because once you started the year 3s and when you tend to patient and you start working on patients, you now actually know why you perform certain procedures, why the treatment is actually required. So these subjects are really important for you. And don't get too scared. It might seem overwhelming for the first 2 years, but you can do it. Even I can do it. I even managed to pass with distinction for all my subjects of year 1 and year 2. So if I can do it, you all can do it too. Okay, right. So now entering the year 3s and to the year 5s, which is our clinical years. It was done here in PIDC. So how is this different from the pre-clinical years? Because now, starting from the year 3, you are now treating the actual person, the actual patients, where you need to apply what you learn to diagnose and to treat actual cases. And you'll be also introduced to the more specialized subjects of dentistry, such as prosthetic dentistry, which is you doing dentures, orthodontics, or you mostly associating it with braces or teeth alignment, and also pediatrics, where we dealt with children in dentistry. So, in these clinical years also, is preparing you to become a professional later in your practice. Because do you know that dental is the only course where the undergraduate students can actually treat the patient and perform the treatment. It's different than the medical. Because the medical, you cannot do treatment on your patient unless you graduated. Only dentistry can do that. So as a student, once you perform your treatments, you've done cases already, you step out of this college, you already become more confident and you have skills to actually start doing your patients. So you'll be stepping into the real work life much easier for me, I guess. And with my interactions with seniors also, I believe PIC might can equip you with the skill that you need in a real life setting. Yes. And this is the clinical practice as a student. On the left side is me doing treatment on a 8 years old patient. And at this time, this patient, when he really enters the clinic, he started crying already. And I am not good with children. But you never know what you can do. I really can console these kids and get the treatment done. So you really never know what your potential could be. You can just work for it, just get through it. And then the right side is me doing the prosthetic denture for the patients. Now, the extracurricular opportunities as a dental student. Being a dental student is not just about studying. So it is more than just that. So at PIDC, we offers you many opportunities. So there's like attending conferences where you can learn new things, new information, and new stuffs, because PIDC is a ever evolving thing. It will continue to improve, continue to change, to adapt to the current situations. So at these conferences, you'll be introduced to the new advancements of dentistry, learn new things, and just keep updating yourself on things. And there's also competition that you can join, either locally or international competition. So there at the left bottom, yes, is me winning the third place in the international dental quiz with two of my friends. Yes, it was an international event with a few, I think around 60, 70 schools, 60, 70 groups with 24 dental schools all around the world. And there's also research program. So here in PIDC, we encourages the student to participate in research to develop your academic skill writing and also to develop your research skill. And this will be done under the mentorship of the very experienced faculty members. And not only you can improve yourself on that, you can also present your research to the conferences, either local or international conferences. And PIDC also has a student mobility and also exchange program where we collaborate with the local and also international dental students. And there are many others such as dental camps, community outreach program, the national sports event where we undergo. So enjoy participating in this extracurricular opportunities not only enhance your credentials, but it helps you grow as a person. So you can be more than just a dental student who studies. So somehow they can make your life, your university life fuller, richer, and memorable. Next is social life as a student. What is a college life without your friends, your peers, right? So developed, friendship of a lifetime is here in PIDC because your friends is the one who's behind your back and who was here together with you throughout this journey. So it's a friend of a lifetime. So here is my friends, my classmate mostly. So we did here in PIDC also we do celebrations of every event such as Christmas, Raya, and also Diwali event, and many other celebrations as well. So we don't just study here, but we did so much more than just studying. We enjoy life as a student by hanging out with friends also, but you have to work hard and study hard also. So next, challenges and ways I overcome them. First is communication skills. You really need a really good communication skills because here in clinic setting, you will tend to patients where you need to explain treatment for them and you need to consult them to get the treatment. So you really need to have a good communication skill. And I have joined election for the school president to somehow improve myself and challenge myself to become more than what I just am as a dental student. Next is balancing the students, balancing the study, clinical works, and also the social life. So you need to be active. If not, you'll just a boring college life for studies. So enjoy sports, make to-do lists, make a proper list and proper routine for you to work out how was your day is and hang out with your friends because your friends is there with you. You study with them, you work with them, doing clinical work for them. So it's working together with them and adapting to a new environment. It's really hard to adapt to a new environment. To make sure you reach out for help and ask experiences from seniors because seniors has went through it. They know what to do. They can advise you on things. And reach out for your help either from lecturer or your peers also because you need support to have whatever you're having through a hard time. But take your time. It will be there. It will be a very enriching and rewarding experience at the end of the day. Once you look back, you will say, oh, I will grow out a lot from that experience. So, yes. And what do you expect as a dental student? So, there will be intensive academics. You will need the long hours to study, to do your preclinical works, and so much more. But what I can say is you work hard, work smart, and also play hard. That's how your college life will be fun while you're doing this. There will be hands-on practice where you having a lot of preclinical works and the clinical requirement itself. But it's okay. You'll get to do it once you really put an effort to it. You can do it. And then building a communication skills is important. And yes, there will be long hours for you because we need to balance lectures, practice, and also self-study. And yes, how to thrive as a dental student. I believe that everyone has a different study method, and you have to find out which one works for you. Some might require long hours to study one lecture, and some might need to draw to memorize. Some might also just went through slide and they get it like that. But for me, what I did is I stay focused during the lecture. So when you went back home, you'll get less time to revise on things. And you actually remember more once you listen from the lecturer than you rather studying yourself. That's how I do, because I don't study much at home. I just went to revise on things and read more additional stuff. That's how I do. But find things and methods that works for you. That's what I can say. And then networking and also communication. Building relationship with your peers and faculty and seek mentorship. So mentorship is a program where you will put in under one lecturer. So you can always reach out to them, get help from them, consult to them if you need anything. They will always here to help you. So don't worry, you'll get through it and it is fun and rewarding experience really. So mental health and self-care. So what's a healthy body can lead to a healthy mind, right? So manage your stress, ensure that you prioritize your sleep and manage your physical health. So here in PIDC we conducted a weekly event and I really went to like this weekly sports event where you can just play and have fun and just distress at the end of the day. And here is my last slide, I believe. This is the student support and assistance. So financial aid is there. You see there's a PTPTN, MARA, also the other banks. And buddy system is a program where you were paired together with a senior. So you can always contact them, get them to explain things for you, and seek them whenever you need help or just get some things to clear out. And last one is the mentor-mentee program. As I mentioned before, you will put under a lecturer. So overall for me, until now, as a fourth year dental student, I believe that it has been a really enriching experience, although I have 1 year to go. But I believe in the future time, I will look it as a really enriching and wonderful experience here in PIDC. So don't be afraid. Want to join dentistry? You can join here. Come in PIDC. We can work. We can be here in this journey together. So with that, thank you. And if anything, you can ask me or you can contact me through the scope also. Yes, thank you so much.